credits expire at the end of the month, millions of Americans are bracing to see their ACA health insurance premiums skyrocket. State Capitol reporter Ryan Hall joins us in Montgomery with what advocates are saying here in Alabama.
Advocates in the state tell me skyrocketing insurance premiums are imminent for people who rely on the Affordable Care Act for coverage. But other leaders tell me those subsidies need reform. Alabama Arise says some 500,000 Alabamians get their coverage through the health insurance marketplace. With ACA tax credits set to expire, Executive Director Robin Hayden says premiums will double for a lot of people.
Families are already strapped, with an affordability crisis. So we are hoping that Congress could still come back in January and do the right thing.
65%, guys, and I'm gonna let the video play after this, but 65%. I want you guys to really remember that number right there. 65%. That is how many people came out in last election and really came heavy for President Trump. And I'm not saying that everybody in Alabama voted for Trump, right? Like when we talk about the blue, you see a massive blue line down there in Montgomery and all these other, cities, but 65%. That is how many people supported a lot of these policy cuts. That's how many people support the big beautiful bill. When you talk about a leaner government support, cutting federal government subsidies and all these different things. 65% of people that sat back and did not do their research and truly voted on identity politics because, I'm a Republican and I've always voted Republican. I will never vote for a communist, or I will never vote on socialism or whatever, or all the liberals. 65% is how many people came out in last election and voted against their own interests. And I'm not saying that all these people are struggling within Alabama. That's not what I'm saying whatsoever. But as one of the poorest states in the United States, I think they're right behind Mississippi. I could be completely wrong. Please excuse my ignorance. But as one of the poorest states in the United States, they rely heavily on the federal government and some of these other states that, supplement for some of the income deficits that they have. It is ridiculous to see how many people, when we talk about farmers, when we talk about MAGA and all these different people that are being devastated by this. But listen, I'm not about to use this moment to kick people while they're down and while they're struggling. That's not the whole point of this video. It just sucks to see that so many and millions of Americans are about to lose their health care or pay an astronomical amount for these expenses.
Representative Mac Butler says there are more affordable options for health care.
But it really needs to be looked at to make truly insurance affordable, because it is out of reach for so many working families now.
In an interview on C-SPAN's Ceasefire program, Senator Katie Britt says reforms are necessary for the ACA, such as putting an income cap on who can get subsidies.
From my perspective, it's clear that the system has failed with regards to affordability because we continue to have to subsidize it to, quote, make it affordable.
Still, Hayden says the expiration of credits will impact rural hospitals.
The benefit of having more insured people is that we spread that risk out, that more people are paying in. Hospitals and doctors and pediatricians are not having to absorb all of these unpaid bills, and everyone is healthier as a result.
Now, I've made a video about this already, and the amount of rural hospitals that they're losing within states like Alabama, and specifically Alabama, actually, we made a video about, guys. They have lost so many rural specific, areas where they got, clinics and, hospitals and, specialty centers. They are shutting down because of, the big beautiful bill. That is truly it. And, some of these issues have been going on for a long time now, but just like tariffs and all these other things, they are projecting and they are making forecasts for the future, and they are shutting down because of these different things. And this sucks, but this is just what happens when you do and don't sit back and do your research. And you have millions of Americans who are seeing their coverage go up. But, this is what happens, guys. I cannot make this up.
So today I logged into the health insurance marketplace to see how much it would cost me to be covered. I'm a single 34-year-old man with no pre-existing conditions, and I'm very healthy. The only drugs I take are 10 milligrams of Lexapro and 10 milligrams of Buspirone. One dental, if it's possible. I get blood work done once a year, and I get my teeth cleaned every 6 months. So I want my deductible to be less than $3,000. The plan that covered all of that was $704 a month. The deductible was $2,000, and it didn't even come with dental. So for me, One guy with no pre-existing conditions planning on visiting the doctor once a year, it's $9,000 a year. My health care won't be covered until I pay the $2,000 deductible. And I still have to pay extra for a teeth cleaning. I think we're broken.
You think the ERs are full now and the hospitals are full now and the wait times are terrible? Let's wait and see what happens when people can't afford their healthcare insurance. I'm a hospital doctor and I'm already we're full up to here with patients, literally patients spilling out into the hallway, don't have enough rooms for them, don't have enough docs around, don't have enough nurses to see them all the time. And when people lose their health.
This is Elder G again. You see, the people in Alabama and Mississippi and Louisiana, the Confederate, they hate black and brown people so much. And the black and brown people ain't did nothing to them. Their parents taught them from centuries to centuries to centuries to hate black and brown people. They're willing to destroy their own health care, their own way of living because of hate. That ain't godliness. That's evil.